Hello, Jennifer here. I'm here to talk about how COEO will enhance patient engagement in healthcare operations for your clients in the healthcare industry. Whether they're calling potential members during open enrollment season, trying to get an appointment scheduled or paid for a patient, or delivering sensitive health information over the phone, prioritizing how you call is the first step towards transforming how healthcare providers care for their patients and members. A growing distrust in healthcare calls has become a painful reality for providers. Patients still prefer the voice channel, with 88% of healthcare-related appointments and payments being made over the phone, and 81% of providers believe phone call conversations are key to their digital-first strategy. But patients are cautious about sharing personal information, and 94% will hesitate to pick up legitimate healthcare calls from numbers they don't recognize, or worse, numbers mislabeled as spam or scam. 74% of patients believe they've received a healthcare-related scam or fraud call, creating a distrust in all healthcare calls. A minimum average of 25% of a provider's phone numbers are at risk for being improperly labeled as spam or scam. Many providers find out too late that their calls are mislabeled. When this happens, appointments get missed, bills remain unpaid, and optimal patient care isn't reached. On average, healthcare providers see a 30% decline in contact rates when calls have a negative call label, like spam or scam. There are additional factors to keep in mind as well, such as overall perception of the brand, internal resource waste, agent productivity and dissatisfaction, and a disappointment in the numbers themselves, which leads to healthcare providers down an unproductive path of constant number swapping to try to get away from the labeling issues. So now that we've identified the problem, let's shift to providing our recommendations to how to stop calls from displaying as spam and scam and to give those numbers the best chance of being answered. Number reputation management is used to protect phone numbers from blocking and labeling algorithms that have been deployed by the wireless carrier ecosystem to keep those numbers displaying clean and label-free. What's special about the solution that COEO is offering is we are not only offering the ability to monitor for and identify when phone numbers become labeled, but we're giving you the ability to prevent those labels from occurring in the first place. This solution is also going to give you the ability to get those spam and scam labels removed and corrected without you having to lift a finger. Our solution covers the big three wireless providers, T-Mobile, Verizon, and AT&T Wireless, along with our analytics partners who deployed the algorithms. On average, customers see 99.8% of numbers cleared of all negative reputation, and we're able to maintain that percent on an ongoing basis, including when the algorithms change. Healthcare providers will see improved outbound ROI, more productive conversations with less phone tag, peace of mind in knowing exactly how your calls are being displayed, and a safety net with direct access to labeling correction when the algorithms do flag a number at any time. Use these quick questions to qualify that number reputation management will help your healthcare prospect and generate interest in a deeper conversation. Are you primarily trying to reach patients on cell phones or landlines? The ideal customer is a healthcare provider with heavily relying on outbound calling to reach patients on their mobile devices. Have you experienced a downtick in your live answer or goal completion rates? A downtick signals a problem with call deliverability or customer engagement, which are core issues that COEO solution addresses. Things like fewer calls being answered, calls going immediately to voicemail, and complaints that no one's picking up the phone, or help desk tickets or feedback reporting numbers are displaying as spam are key indicators. Do you know how your calls show up across the different wireless providers? If the prospect answers no, this indicates a lack of visibility and control over their call reputation and a need for COEO's expertise to improve their call performance and patient engagement. If the prospect answers yes and is already aware of a spam labeling issue, then even better. What is the primary intent of your outbound calling? For example, are they calling to do appointments and prescription reminders, open enrollment calling, patient support, sending healthcare alerts, and collecting payments? These are all common outreach efforts from healthcare providers that are prone to spam labeling issues.